Okay, good morning, viewers. Welcome to another episode of Monitor Your Health with Dr. Ogunremi. As usual, today we have a topic to enlighten the public about. It's a topic that is very interesting. I've been alive to know about this. We know that millions and millions of people suffer from this condition. And a lot of young ones really want to know about it. And it's about acne. We're talking about acne today. To discuss today's interview or today's topic, I have with me a reputable dermatologist, Dr. Akolawole Michael. Welcome to the program, Dr. Akolawole Michael.
Thank you very much.
Thank you so much.
My CEO. All right.
Right. Can you introduce yourself to our audience?
Well, I'm Dr. Akolawole Michael Abayomi. I'm a consultant physician dermatologist and also an entrepreneur, like you said. And I consult with Limi Multi-Specialist Hospital and in Abuja. And I'm also a serial entrepreneur with managing some group of businesses. This is all about me. So I graduated in university. Yeah. So I think that is all.
Yeah, thank you. There's a lot.
You want me to?
Let's have this. That question is okay. People will explore the long version. There's a lot about this. All right. Thank you so much today. So we're talking about acne. Our appearance is very important. People don't want anything around the face. I personally am very meticulous about my face, about my face, and I know it's the same thing with quite a lot of people. So today we decided to choose this topic. And so, what is acne, Dr. Akolawole?
Well, like you all know, the major destruction in the body is inflammation. So almost every pathology is related to disease is made of inflammation. So we have a pocket, an in pocket on the skin that houses the oil glands, and then where the hair come out. Why the hair come out is called a dot. The two are called pilosebaceous dots. That's the dot where hair is coming out and is being nourished by the sebaceous, the oily glands. Now, when the the dot, that's the pocket is blocked due to inflammation, it gives you a comedo. It is that comedo that we see, the heads, the black and white head. That comedo is what we see as acne. So the out pocket, the outcome, the out pocket or the outflow of where the air come out and the oil that is the sebaceous gland, which is not oil, is that nourish the air glands and also nourish some part of the body is blocked. So that pocket or that opening is called pilosebaceous dot. Now the inflammations and the blockage of that dot is what's called acne. And we see it as black and white heads. So when you see those things as black and white head, it's now seen commonly as acne, what people call pimples or comedos. This is what acne is all about.
Wow. Yes. Okay. So acne is pimple to the layman.
Yes, acne is. Yes, and it's blockage of the dot that houses the hair gland and the hair follicle. That's all.
Okay, thank you so much. Now, when you were talking, you talked about inflammation. I think people might be asking, what is inflammation? What is inflammation? Important word that you are throwing out there. Please, you need to break it down for us to understand. So,
yes,
inflammation. What is comedo or all these things that you're talking about?
Yes. Comedo means black heads. You have black heads and white heads. When you have white comedo, that's what you see like white on top of the pimples. It's called white heads. Why the black one is actually because it's been digested or it's been acted upon, oxidized. Oxidized means we're breaking down to some products and it becomes black. The white one is intact. Why the black is black? It's actually been whether through opening or through other things being interfered upon and something that acted on it, inflammation, so it become black. Now, inflammation means disease of the body system. You know, I won't say, I don't know what about. Normally, the body system is in stable states, whether it's gland or anything, gastritis, dermatitis, anything that has to do that it causes disease of that thing is actually because almost all conditions lead to inflammation. So that the disease of that oil gland is called, you know, of that oil and eye gland is called inflammation. So inflammation is actually a disease of the body, almost all the systems. The body reacts by getting that something foreign is happening to me, and it tries to eliminate it or try to adjust. And the method of adjusting or trying to eliminate or try to cope with it is called inflammation.
Okay, so basically it's when the body fights against something that is not supposed to be in it. And that's
yes.
Okay, so it's the war, as in battle that the body is fighting against something.
Yes.
Now, so what are the types of acne? Because you see, also you've talked about it. Is it the white and the black? Is there any other type of acne?
Well, when you talk about acne, the black and white head are description. That's the normal what people think that acne is, because what they see outside is different from what it is. The white and black head actually what is called acne. I mean, what people see as acne or pimples, the black parts, the white part, this one. But the real acne is based on description and based on causes. Let's talk about description. We have the simple one that is common, which is called acne vulgaris. That is when the body immune system starts developing reproductive system. So we find that at that time, people have what they call the skin start responding for the first time of seeing that. That is acne vulgaris, normally common during the teenage years when the reproductive system. In children that have hormonal problem, you can even have neonatal acne because they have hormonal imbalance. Then you have the nodulocystic acne, which is actually due to it has become so big, a lot of pores, you have nodules. Then you have the cyst acne, which is, you know, looking like that. Some how they look like or causes. Then those are, we have nodulocystic acne, acne fulminans, because it's fulminant means it's deadly, you know. Then we have a lot of other acne, but the basic one based on the look is those simple acne, the comedoma acne, the cystic acne, the combination of the two, nodulocystic. Then when there's pus or it comes with fever, we have acne fulminans. Then we have when it's caused by the causes, maybe due to cosmetics. You have cosmetic acne, you have pomade acne, you have acne associated with other syndrome of the body. That means when you look at it, we have certain syndrome that is linked, that I don't need to mention them, but it's linked to some other endocrine problem. It could be linked to some other endocrine. So when the whole syndrome is coming together, it's also linked to, actually related to syndrome. In that case, not all physical acne are actually normal. Not all of them are physiological. Not due to, but most of it, we even talk the physiological are deadly. So it's better, there are signs, there are forerunner signs, there's a bingers of what to come. So most of the time, there's nothing like normal acne now, which is what they call acne vulgaris. There's normal, it's a sign for you to watch out and for endocrine and some other conditions. So acne is, the skin is just a part of other parts of the body. So whatever the skin is getting from hormone from the skin is also reflecting. So acne is not soft, and that's the perception of most people. They think that the skin is totally different. So I can use cosmetics. The way you attend to pancreas, you attend to liver, you attend to whatever is getting to them, is getting to the skin. So luckily it's so open so that if you can read the skin very well, you can also predict what is happening to other systems. This is exactly what acne. So in summary, the communication could be based on how they look like, the pomade acne, you know, what you use, the causes, whether you are using they have acne from mechanics because of the oil from mechanics, you have acne from pomade, you have acne from cosmetics because you are covering the pores by the chemical you are using. You now have the normal acne vulgaris. You now have the one that you have in adults, which is related to other syndrome, other chemical hormone cancer that you have in the body. But it's not all acne. Acne are just not simple as most people think they are. Thank you.
Wow. Okay, so we just see pimples. We don't know that. I mean, it's interesting. So there's so much going on right there. Oh, we can't see your face. Your environment is a bit dark. So it's more than just seeing a bump on my face. There are a lot of things go on there, and relate to certain things that I do. As you talked about the work that we do, like the mechanics, for instance. Right. That's interesting. Okay. So, are you there?
Yeah.
Okay, that's fine. So, what are the symptoms and signs that we see or that people take when they have acne?
Well, the symptoms and signs of acne are actually very obvious.
Okay.
Hello? Yeah, the symptoms and signs of acne. Yes, the symptoms of sign of acne are very obvious. Like what more people see are comedos, what we call pimples, which could be whitehead and blackheads. Then sometimes you don't see that's when it's early. But when it's late, you start seeing the complication. Like some of our artists like Alex Osifo, some other companies who have some, evidence of the poorly managed acne or damage. You see them or chicken pox, what people think. When there's chronic acne on your face, it leads to a lot of complications. Some pigmentations. So you have all those that are leaving a lot of black spots. You also have puckering scar that are indented. Then you also have the pores, keloid, scar, hypertrophied scar that are thickened. These are things you see as complication. Sometimes it's cosmetic. What kills them is actually the self-esteem, the psychological aspects. You see a very fine person, but getting psychologically down. So those ones are the quality of life is actually killing. Who was probably managed, now coming with that. But like I've said, acne does not come alone. It's actually an hormone-driven condition. So when we see that, we always look at other conditions. But when you see complication of acne, is actually a complication of other conditions that are actually coming from the system. So in short, in summary, we talk about pigmentation, pimples, cosmetic disfigurements, you talk about low quality of life, you talk about black spots, damage of self-esteem. These are complications, and people can actually kill. I've seen people who actually want to commit suicide because of complication of acne, even though it does not kill like other conditions. But like I said, the quality of life, because your face is a passport to the world. Yeah. And once you miss it, some of us, even as a dermatologist, some of that got punished from using dye, some other things. So once you do things that the skin doesn't want, it deal with you. I mean, and the process, the complications are there. So the skin react, which are all product of complication or disease process, which include pigmentation, scarring, and co. So in summary, these are the problem of, complications. These are what we see on the outside, and they are seen as actually features of acne.
Okay, thank you so much. So a lot of people have pimples. I do have pimples, and most people do have pimples. And I know that the question that might be pondering people's mind is, why do I have it? I don't want to have it. I know we'll talk about the complication. I know you've mentioned some, but we might need to dig a little bit more about the complication. But how does it happen? Why do I have it? I don't want to have it. So I need to know why it happens so that maybe prevent some of those things so that I do not have it.
Well, thank you very much. The causes could be hereditary. The causes will be due to, like I told you, hormonal imbalance. It could also be linked to the kind of diets. It could be also, so in main thing, let's look at it. We have hereditary causes. We have that due to your own system, which will be endocrine. Then we have the environmental causes. So let's look at the hereditary. If you have the tendency to have hormonal imbalance or you aggressive, we call it androgen. They are linked by genes. So it's either the receptor, your own body is sensitive to those male hormones receptors. The female hormone actually promotes beauty. So you see very fine face means that you're balanced. But when you now see that you have hormonal imbalance, it could actually be genetic. That means your tendency to produce male hormone is higher. That's one. Two, even if you produce them, your cell, the oil cell and the cell in the pimple cell actually very sensitive. So you have the androgenesis, which is due to the fact that you inherit the tendency to produce more. Then you have androgen sensitivity, which means that you are, even when the level is normal, you are sensitive. These are the conditions. So that's why you will see acne coming in the teenage year, even in neonates, where they have hormonal imbalance, you can pick it very early. So androgen act on the skin. So once you inherit the tendency is high, then we now have your body systems. Some way of life actually disrupt the hormones, like the kind of sugar we eat, like the chemicals, some of the food, genetically modified food. Those hormones will be lying fallow, but you go and wake them by taking genetically modified food that upregulate those genes. So those genes come into being. They have been suppressed before. So it's saying this thing that gene load the gun, environment pull the trigger. Now, in the environment, we have internal environment, which is how your body naturally works. External environment, which is what you eat and what you are exposed to. So hereditary tendency is there. If you are able to discipline your internal environment by not provoking it, most of the causes will not come out. But if you take things, your weight, lifestyles, maybe you don't exercise, you don't burn your sugar, and they are converted to fats, then some of these fats, your body, if they are not oversensitive to your system, you have problems. Then if you now take food that disrupt your, call them endocrine disruptors. This food includes, high sugar, some other sensitive other things like even milk, some other, which currently this is the current thing. Some cow milk, some other milks that you're allergic to. Once that system's pick it and it doesn't like that, there's inflammation and you'll see that. So some have been linked to groundnut oily food, but we think the oil and some other, in fact, the real milk, the casein and the whey proteins in milk, it's not even the oil from milk. It's actually almost all the content. So some of these things, the one you are sensitive to. But whichever way, you have the androgen, which you have the tendency, that means the gun is loaded, and then don't pull the trigger with your way of life or what you take, like that disrupt the hormones. These are my own. So some other things include animal hormones, now we just eat. So taking organics will help and other things because it's not going to, they're used to your body, return to the head, and they're using that protein and system from the head back, not that it's being modified. But modified food, modified chemicals that are not organic, taking animal products that are not organic, all these eventually disrupt your system. And once your system is disrupted, the hormone is not balanced. There's excess production of one that lead to cascade of, release of others. And you eventually get this acne. And unfortunately, most people will not correct that. They'll be correcting the cosmetic aspect. So therefore, caking their space, getting it more, try to use some procedure which are temporary, while the system, as far as those systems are being disrupted, you will keep, you are going to be addicted or you keep on that thing, that preventive or cosmetic thing, because it's not solving the problem. These are the causes, or what I would say, the risk factor for acne.
Right. Thank you so much. Now, it's very interesting now because, I know we're talking about the skin, but it just ponders in my mind what we're describing. If we look at our lungs, it seems like if you have this in your lungs, it's like you're describing like asthma. Is there a link?
No, maybe you get me wrong. There's no link to asthma, but we're talking about endocrine.
Yeah, I'm trying to touch on something. Okay, so if you're going to treat, if I want to look at how to manage my acne, how will I manage it effectively? Because if I have things for asthmatic patients, for instance, you try to prevent, a kind of immunological reaction, and you try to give them, all those. Is this similar when when managing my acne, or how does it work when it comes to the management?
Yes, I've told you that if you have a dish like you now, you're just lucky to be a man, and I'm surprised if you don't have acne in your teenage years because you're muscular, you look athletic, which means that you have more androgens, and the skin responds to that androgen. So what we're saying that we look at you that you have the tendency, hereditary tendency. That's one. Then number two, we now look at, do you have internal triggers? Your immune system is not there now, but what we're now saying that even steroid can lead to acne. We have steroid-induced acne. I didn't tell you because you keep using steroid all the time, and it's actually going to affect the opening of that gap. So we have steroid-induced acne, but the steroid-induced are not big. They are very small, and it's actually multiple. So because once you're addicted to steroid, you keep using it. So we have steroid that could be well. On the management, once you are endocrine, you have to, once it's endocrine related, you have to keep suppressing that. At some stage in time, maybe because of childbearing or because of changes or along the line, the system can adjust itself. But most of the time, that's why when you have childhood, some people say, oh, just leave it. It's part of growing. It's your teenage year. And as your body system tries to settle down, you find that the acne just disappear on its own. But for some people, it never did. They're actually going to get complicated and then fussy, and the damage will be very, very bad in future. So we have to assess it. You can't leave everything to chance. You have to like, oh, this acne is hereditary. It's been bad in your family. We have to tame it. No, you cannot eliminate the gene, but we can actually tame the gene so that it does not cause the problem. Because once you have the gene, definitely it's just waiting for the internal or external environmental triggers. Right. So, like for people now, you have the hereditary, so reduce the sugar, reduce your trigger, try to balance the androgens with androgen balancing drugs. This one we use the list of contraceptives and all that. That's what we use them in acne, in addition to things that stabilize, that make the skin very insensitive to the hormone. This is when we come to treatment, we talk about that. Yes.
Okay, thank you so much. So there are ladies, just like you said earlier on, that they come to the doctor and maybe treatment seems to fail. We'll go to treatment very soon, but treatment seems to fail, and it affects them so much that they then start thinking about even harming themselves. Some people want to commit suicide. As bad as that is, why or what can they do? I mean, maybe we should go straight to this treatment. How will they manage situations like this to actually prevent people getting into that stage where they start thinking, negatively?
Yeah, thank you very much. Like I've told you that acne is, the skin is sensitive to what is happening in your body, especially your endocrine and other systems. So if there is actually hormone related, no amount of cosmetic treatments is going to replace treating that hormonal problem. So if you have an hormonal imbalance, that's why we are linking acne to infertility, to ovary, to estrogen, to other hormonal imbalance. Once that hormone is imbalanced, cosmetic will make it worse, because you keep getting you addicted, and then you keep using your drugs, your money, your resources, and trying to cover the skin, and some of the chemicals, you even react to some of the chemicals in the process of trying to manage. Some will do facials, you do all that. And it doesn't solve the problem. So what we need is to correct that hormonal imbalance. Sometimes you use, if you cannot correct it, like we said, there are drugs that actually block the sensitivity so that the skin will not be sensitive. But that does not remove the hormonal imbalance. Most cases, we see people with acne at a certain year and say, oh, you have issue of infertility. I mean, we can correlate that this person may be linked to infertility. And they say, wow, you know so much about me. I say, no, it's the same hormonal problem that is causing this acne. So, but most people treat from the surface. They feel that acne is not even related. It's not the doctor problem. They can go to cosmetic people that are over-the-counter cosmetic people and get products. And when your body is telling you from your face that there's a problem, solve it in your system. Instead of coming to endocrinology or dermatology that know all what to do, and we link it. You start infertility, specialists. You just come, you start going up and down. By the time you come back, it's late. Take, for example, you have a finite number of eggs. When you have a condition like PCOS, it wastes your eggs. Egg that should be 1 or 2 is releasing 20, 80, 12. By the time you come, you have premature menopause. If you have paid attention to your acne, we'll have said, oh, it's related to fertility, and we'll have addressed it and balance that hormone, and you'll go back to releasing 1 or 2 eggs. But because you did not, you release an egg that is not mature, that could lead to miscarriage, lead to a lot of other preeclampsia, correlate to a lot of conditions like that. So we find that these things are all linked. So what are the outline of management? One, cosmetically, we can give you a short term so that when you are getting treated, because the treatment may take a long time, 3 to 6 months, you are getting something, we are also managing the inflammation, maybe with steroid, anti-proliferative drugs, which are something ritual. But the more importantly, the common ones are lifestyle management. Try to balance the androgen-estrogen cycle. Once you balance that with your food, remove your endocrine disruptors that is disrupting your equilibrium system. So you go for more of organics, you go for more of them, then we give you drug like oral contraceptive pills to balance which kind of, we have a pill like ciprosterol now that balances, block the androgen, and then enhance the estrogen. Once you have that, the system tends to balance. Then we have, but we have side effect conventional oral contraceptive drugs. So we use the special one now, which is ceprostin plus estradiol. Those drugs helped in doing those things. They reduce the androgen so that the ratio between estrogen and androgens are balanced. Number 2, they also boost the estrogen, which is the beauty hormones. Then the second one is to block the sensitivity. and the proliferation and inflammation of acne at the skin level. So that with isotretinoid, we have tretinoid, we call them retinoid. We have the cutaneous one, we have the oral retinoid. So isotretinoid, we have other adampalene and other, the Aula series, 4th generation, 2nd generation. What they do is to make the skin, the receptors, insensitive to the hormones and whatever thing that's pushing, that's triggering this. So once they block it, the sensitivity is reduced. And once the sensitivity is reduced, we eventually go through until the hormone system is balanced. So isotretinoid, topical one, retinoid, and oral one are being used. The other one is lifestyle, I've told you. Try to balance it. If you find out that you are taking some food that disrupt your immune system, from the kind of food, chicken, maybe using hormones from animal, using a plant hormone, we call xenostrogen, which is plant hormones or abnormal hormones. Once you have all those ones, they disrupt your system. The other one is to go for food that are natural, that are organic. Those ones are more natural. They are good because we return to mother health. And plants and co that are organic that are used for mother health are better. Then you have things like green teal, a lot of other things that tend to balance this system. They also reduce inflammations. They're more they're antioxidants. So we go for those things instead of those artificial things that are not natural and they disrupt our system the more. And they call it complication. So these are some of the lines. So lifestyle, summary lifestyle, retinoids or all those retinoids. Then the second one include hormones, balancing the hormones. These are some of the things we use. And then controlling the inflammation. Either locally, we can inject those places where there are scars or where there are hypertrophied scar. We can also give you some steroids because sometimes the inflammation increases as you treat. So, and you could get discouraged when the drugs start working. That, it's getting back for the first 2 weeks. So to do that, we have to give you some steroids to reduce the inflammation because the inflammation that causes damage is actually not the hormones. The hormone just kick off the inflammation, and inflammation eventually destroy, whatever thing. The product of inflammation become scarring, getting dark, formation of pigmentation and all that. They are all due to product of inflammation. So we control the inflammations. We try to cosmetically manage what is on ground. If it's dark pigment, we try to control it. We even tell you to use cosmetics blenders that actually mask those things, pending the time full treatment comes on. So a lot of ladies actually don't address the acne. They just use cosmetic. And at night, in the morning, you find that when their husband see them, say, what kind of face is this? So I advise people to come early. So this is what, but the important thing is to know that this thing is steroid. This thing is more than meet the highs. And sort it out because it could actually be responsible for your infertility, like we said. Thank you.
Thank you so much. So during the course of this discussion, you mentioned about steroids being can be a cause of it. But this same steroid is still used for treatment.
Can be used too. Yes, it's a double-edged sword. Steroid in the hand of a expert is a good one. But when it's in the hand of people, you have what steroid give you? It give you a suppression thing. Almost everything. Most people have problem with condition. They just use steroid to suppress it. So when you use it, it suppresses everything. It gives you a temporary relief, and you get addicted, on that until the steroid is no more. This type of the steroid is no more okay. You have to go for a more potent one until you destroy yourself with the complication of steroid. So you are not addressing the cause. A lot of our doctors are company just treat the symptoms. You have this, okay, it's inflammation. Just use this steroid to go. Of course, 90% of people, that's what they do for the skin. But you address the cause, and then it's not. But then when we are also treating some inflammation, we have what they call IRIS, immune response, inflammation response syndrome. It's not only for certain disease, even for acne. So once you have this immune response syndrome, in constitution, the inflammations keep getting better because some of the products of those treatments are released to the body. So the body mounts further inflammation, which is also what's happening in COVID, So if you don't use steroid to damp it, the damage will be done, even from the treatment. You may even die from the damage. A lot of damage will come, scarring and co. will come more from the treatment that trying to treat the cause. So you have to use steroid at that time. But it's only the experts, because like I told you, steroid is a double-edged sword. Only the experts will know when to use steroid, when steroid is causing complication, and the type of steroid to use, and the grade. So that is why you don't go to and buy a tube and say you are using to bleach. In fact, that's what most people do. A lot of the tube in the market, you just use it to see your bleach be smooth because the inflammation is reduced. But the content, the cause of that thing is still there. The hormone is just being suspended. As soon as the steroid is over, you see the thing coming back. So then you go for higher steroid until the complication of steroid destruction, complication of vascular destruction come with diabetics, with other things. your skin will become thin out, you start having a spray, you start having a little surgery, your skin break down. So most people don't know. They just go over the counter and destroy, and you even get systemic absorption of that steroid, damaging other structure in internal organs. This is what you see.
Okay, so that's
hello?
more like, hello, we're with you, we can hear you. So it's
yes.
like a vicious cycle now. If one gets into that loop,
yes.
getting out of it becomes
yes.
a issue.
Until you are totally destroyed, because now come with what you start Cushing syndrome, you start pathological fracture, diabetics, because you have been on the tube. I know people who have been on the tube for a long time because it's smoothing their face, but that does not control the environments. So this is what you see. So this thing disrupts your system. Steroid can be converted to androgens. You know, we have backdoor pathway. It can also cause diabetics. It can worsen your sugar, and insulin we have to overwork. And once insulin overwork, we have insulin growth factor, all that, and the whole system just destroy your hormone imbalance. And you're coming with a lot of other things that shouldn't have come up with. So this is what, but most people want shortcuts. They don't want to take the normal route. We agree, maybe our health insurance, our healthcare is expensive and little of health insurance, but I will advise you that it is better to see an expert than to be hooked or addicted to steroid. This is my own suggestion.
Wow. So for people who are already in that loop now, they'll be wondering, what can I do? Is that the end of the road, or is there what can they do at this stage?
Well, for those who are addicted to steroids, there's a way we manage them. We have to tame it down, step it down. We have to use steroids that are lower in potency because the body's already used to it. So once there's like a withdrawal syndrome in psychiatry or anything you're addicted to, in heroin or do drug abuse, that's what happens. So the drug will be, we have to start with low potent, maybe hydrocortisone, which is low potent. We have to start with until the system gets used, because your body is already used to it. We have syndrome called Marois, the body is used to it. Then the second time, after some time, it exhausts that one and it wants a bigger one. So you go from hydrocont to temprosol to Damovate, destroying yourself. These are very high potent drugs that can destroy your body system. And totally. So to stop it, we go, as you're already up, we will not withdraw everything suddenly. We have to go gradually until you are down, or then we now remove it. If you remove immediately, all your pimples will come back. Some people now, they cannot do without those steroids, you know. And once they stop 2 or 3 days, you see their full face. So all the fine face you see, they are just temporarily being managed, you know, with steroids. So they don't come to you because their body on it until that, you now see them getting big. Somebody that is a normal model kind of structure, you now see them getting, especially when they now give birth, they are more open from pregnancy, combined with the one from the tube. You now see them becoming elevated, you know, their leg become, they say, oh, how do you manage it? And these are people that are not exercising again, that are not even, they are taking a lot of carbohydrates again, that are being converted to fat. So the whole, it's a vicious cycle that will not end well. So you have to see those who know a lot. So doctors that are interested in endocrinology will help you, because they are on both sides. You can only the endocrinology that are interested in welfare, but we really have to correct it. And hormone imbalance is the major cause of problem in this world. I mean, as for health issues, the link to acne, diabetics, all the other things, hypertension, they're all linked. So we think hormone is a very strong thing that you should not play with. And a lot of over-the-counter medications are actually causing this problem. Thank you.
Thank you so much. It's interesting. So for people who are already in this loop now, who know that
they have to be managed.
They need to be managed, and then they need to see
yes.
if they must do
we have to take them off the loop. Yes.
Right. Okay. So they need somebody who is quite skilled in that.
Yes.
Okay. On that, I mean, it is very important, because I know there are a lot of ladies, or not only ladies, people out there who are on one steroid or the other, and they've been on it for a very long time. People don't even understand the way the steroid works, because I had a patient the other time who just, in fact, not really a patient, was one person that got involved in a job with. And then every morning he would take a medicine. And I said, what do you take? He said, he's taking this medicine. I looked at it, it was prednisolone. And he's been taking this for years. Every morning he just copy down. Prednisolone is a steroid. And I thought, why are you taking it? He said, oh, somebody advised me that if I take it, it makes my body smooth to make this happen. It's just something I have to use. And he kept on it for years before he saw me. And then I thought, look, this is not good for you. Your system is AWire at the moment. We need to get something. Eventually, fortunately, it happened to be talking to me. So I referred him to see somebody who can help him to win things down. Why I said this is, steroid is very, very tricky. A lot of you guys there who are taking this steroid, taking it for a long time, you just stop the steroid. I've seen situations when some people stop steroid suddenly, and then they go into adrenal crisis, which is life-threatening. So it is very important for you to look for somebody who is skilled in managing this for you, to look at the primary cause and see how they can actually help to sort things. And if you have challenges with doing that, you can also contact doctors on our platform, Area Doc, where we book appointments. Even we can book appointment with Dr. Akolawole Michael for you, who might be able to manage things possibly remotely or even if it's going to be physical. So it is very important for us to look at this. Thank you so much, Dr. Michael. Now, you said so many things, and then I look at, the infertility bit, because we mentioned this, and I know a lot of people will be asking, okay, they talk about infertility. Can my acne cause infertility? I know you've mentioned it, but I want us to have a 2-3 minute session on this one to enlighten people on how this links and how they can, if they're in a situation, how they can get things corrected for them.
Thank you very much. We can't say everything here. When you are translating from academics to business world, it's a lot, like I've told you. But most of the things you mentioned, some of them can write it down and possibly get online to have more understanding. Now, there are new diagnoses called androgen SS, androgen hypersensitivity, polycystic ovarian syndrome, what they call PCOS. This is the commonest cause of infertility worldwide. And one of the manifestations is acne. So even for a child, most people wait until they want to get married. And when you get married, the damage is done. Your egg is all wasted. Your egg has a finite number. Once your hormone is balanced, you're supposed to release 1 or 2 eggs per month. But once you have androgen maybe because the dominance of the gene from your father is working on you, you see people getting unduly tall, unduly muscular, unduly fat. These are effects of these hormones on the system. And one of the manifestations on the face, your face is rough. Anytime around pregnancy, you have a breakout. Anytime, and when you have a breakout, why? Because your reproductive system is linked to the skin. So the skin actually is just like other organs. So once that hormone is actually causing your system haywire, we see it, we can pass it on the skin. So it may not be the acne causing the thing, but it's reflecting, it's telling you, look, this hormone is bad, I'm under intention. And the skin seems is the only one accessible of all the organs. So it's telling me, look, this is what is happening in your system. And instead of addressing it, you are there going to see cosmetics and cosmeticians, all those cosmetic people trying to cover up instead of addressing. So if you want to have severe infertility when you are in 20s, you will see evidence in your teenage years. Severe acne, you can be increasing weight. These are evidence of hormonal imbalance, meaning you are more androgen than estrogen. So if you are a man, you see you are masculine, everybody love it, and everybody see your macho and co. Even excessive macho could be a problem. But when you're now in females, where everything should be smooth, you are now getting that. You find that you are a male body, what they call aquaja. In the olden days, you find most women they call aquaja never give birth because they are seeing masculine features there. Some people are unduly tall, that's the effect on the bones. Some are unduly muscular, that's the effect of androgen on the muscle. Some are unduly, fats, that is effect on the fat. So we see this, we link it with what your face is looking like, and we can predict that you have hormonal imbalance. And if you continue like this, you didn't address it, your egg will be wasted by the time you want to get married in 30s. If you have finite number of eggs and you are supposed to release 1 to 2, and you are releasing 10, 12, because the mean average is 10 to 12, that means you are going to waste your egg before you finish your marriage, and you are going to get to premenopausal syndrome. You have wasted the egg before the time you want to, and the quality of, even if the few one come out in your 30s or early 40s, you want to get married, it's the poor quality. So if you go to IVF, it will not work because the IVF use somebody who has a balanced hormone. Most people they will not tell you what they are going to do. Until then, they will tell the quality of it is bad because that egg have been under the intense action of androgen. And we see it by seeing that your face have acne. However, in some few people, their face is very insensitive to the hormone. So we look for other features. Being muscular, being hairy, you have beard, being broad voice, maybe your voice is broad like a man, you are already balding, which is effect on your scalp. Then, so various organs will be sensitive. So if one is not sensitive, we look at the other organs that are sensitive. Your bone is sensitive, so you can be 7 feet. So we know there's androgenic effect on this, correct with growth hormones. And once the androgen is high, this growth hormone come in, hyperinsulinemia, diabetics, all are all linked. Like you say in the diagram I sent to you, they're all linked. So the best thing to see an expert to address this very early. Even a child with neonatal acne may be evidence of hyperandrogemia. That means there's too much androgen in the blood, and you have to follow up that child. Otherwise, the child may have precaution over it. Other things come in, just disrupt you. And with the environment, the lifestyle we take, and the kind of poor exercise we have now because of our sedentary way of life, everything is compounded. So you find out that the whole thing is linked. So you just have to go to an expert to take you. Don't wait until you are getting married before you do. Once you start having beer in your 60s, you're so tall, you are looking so muscular, you are like a tomboy, you are very aggressive. Even on your psychology, on your mental life, the way you talk, the aggressiveness, it's all linked. It's all linked to all this imbalance. Like a man, like a tomboy. Most people talk tomboy, your way of life. You have to watch out. So things are changing. The trend is changing. It's no more just wait until the whole complication come in before you come. So acne is related to, it correlates with hormonal imbalance, especially when you live the teenage years. But even the one we say acne vulgarina is normal, is no more normal. Not all of them are normal. Not all of them will get corrected automatically. You have to follow them up. Okay, we have seen 14 years old in my hospital with PCOS, which means that the imbalance is pushing it, and or a lot of cysts are coming out instead of 1 or 2. And those cysts are poor quality, and they are wasting your egg. So if you don't address them now, you don't know how many eggs is going to remain before you start wasting. Some people say, I'm not ready to give back now, just laugh. If you know you are PCOS, there are options for you. Is either you correct it or you go and freeze your egg. Otherwise, it's not your egg, it's somebody else that will be given to you. And most infertility now in advanced stage, that's what is happening, because their egg have been destroyed by this polycystic ovarian or androgen excess or hormonal imbalance. This is my own submission. Thank you.
Thank you so much. So for ladies who maybe they're in their 30s now, they still have all these, pimples and things like that.
Yes.
Caution is for them to actually seek, medical advice, see a specialist.
Yes, advice. Yeah.
Wow, that's massive. Thank you so much for all those great information you've given. Yeah. Now I know we're getting to the tail end of this now, because in another five minutes or so we're going to be rounding up. I want to touch on just a couple of things just before we get to that stage. I'm taking us back to the advice you gave us earlier on. Somebody was asking, how do one know the kind of food to take that will not affect their immune balance? You understand? What sort of food, or how do we know? Because these are the things that we get in touch, we are in contact with. How do we know? I just want to eat.
Thank you so much. Like I've said now, everybody's growing organic. Why are they growing organic? Because a lot of chemicals from fertilizer, genetically modified food, hormones from animals that are infused into these foods are disrupting our normal systems. So you can't go to Mr. Big and get chicken of 3 weeks that have been inflated with the growth hormones or with steroids or with androgens to make them to form on time. So you go for natural ones. You make your own way. So that's why organic is more expensive. Things that are not adding with herbicide, that are not linked to fertilizer, that are not linked to steroids. Some of these crossbreeding, in the process of crossbreeding, a lot of this genetic modification has a core. And so when you take these things, that's why everybody is banning them. Because these children, very 12-year-old is looking like 20-year-old now. So it just wake up those genes. You possibly have the hereditary tendency to do this, but those triggers are linked to endocrine disruptors, and some of them that are linked for those foods. So you have to look at which food are low. If you are the one that have excessive androgen, like saw palmetto, like green tea, like there are a lot of online, both herbs, both tea, both food that are very good in estrogens. And then those ones that suppresses androgens, you go for those food. So they're online, you can get them, and then we know that these food are not good. So you have to take those food away. But like I've told you, most of them are linked to herbicides, genetically modified food, carbohydrate food, milk. Milk, you have to pick your milk, cow milk. Some of the documents I sent to you, you see how those heavy carbohydrates. So you have to use organs that burn out your carbohydrates. You don't take carbohydrate because you need it. Because you are hungry. You take it because you want to burn it. So you have to use your muscles. That's why exercise is important. Exercise burn more muscles. Your brain, your exercise, your muscles, burn muscles than fat. If those things, you don't use them, they get converted to fat. And they get converted to fat. And those ones converted from carbohydrate, they are dangerous. Even normal fat is less dangerous than the one converted from carbohydrate. So you have to look at it. This body is used, it's supposed to be used for exercise, muscles. So exercise those muscles to burn those fats. And don't take those food and to burn those carbohydrates. And don't take those food when you don't need them. So every carbohydrate you will use will be high fiber, so that it's not released massively. So refined food are bad because they are going to flush your system with the carbohydrate, and it's going to increase your insulin demand. Hyperlipidemia. When you burn out that insulin, you're going to eventually go with type 2 diabetics, and the hormone is disrupted, and they're all linked. So I think these are all over. We can't see everything together in this interview, but important thing, go for food that are low in carbohydrates, food that are more of estrogens, food that are more natural, food that reduce hormones that are more organic. These are few I can say. Thank you very much.
Thank you so much. Okay, so for the documents mentioned, please, because of the time I can't share it here, you can just follow me on Instagram.
Yes.
I've put it on the comment section there. Dear Femi Ogunremi. I will paste it on my wall, and then you can pick those information there. They're quite elaborate and quite comprehensive. I can't share them now because of the thing. So thank you so much. Even though we've run out of time, I would have loved to answer this question. Maybe I should just chip it in. If somebody is asking, if I eat vitamin A a lot, would that help me? Or is that what I should be looking at? Because you said you use retinol or something like that. So this is just a question from the public.
No, vitamin A and retinol are two different things.
Okay. So
it could help, but it's all the vitamins are very good, but it's not the vitamin E. In fact, I would prefer vitamin E. Vitamin E is more stable. So I would prefer that A, D, all the vitamin in right proportion will work. We still have to stabilize your hormone system, but that does not replace your lifestyle. You understand? Having vitamin with not exercising and allowing a lot of sugar to play in your system, or taking a lot of those artificial food that are injected with animal steroids, it's not a replacement. Will not solve the problem. You have to face the music and work by principle. Thank you, sir.
Thank you so much, Doc. It's been fantastic having you here to give us this, knowledgeable, experience that you have shared. We really appreciate you. Appreciate your time. Thank you so much. And to the viewers, thank you for joining us again today for this program, Monitor Your Health with Dr. Femi Ogunremi. We'll be looking forward to seeing you again in our next episode, which I think is next week. And until then, stay clear of Corona. Make sure that you wear your mask, cover your nose, cover your mouth, and have the best of the rest of the week. Thank you.